Thank you. As families prepare to gather for the holidays, adults 65 and older face a heightened risk of severe infection from respiratory illness, especially COVID-19. Multi-generational celebrations and long hours spent indoors, especially watching football games, create ideal conditions for viruses to spread. So, how do we protect ourselves and our older family members from the highest risk months of the year? Now, here with critical information is I can't even talk respiratory specialist, Dr. Juanita Mora. Good morning, doctor. How are you?
Good morning. Such a pleasure to be here to discuss such an important topic with you.
It definitely. And Dr. Mora, why are older populations more at risk for severe COVID-19 infections?
Well, when we look at people greater than 65 years of age, first of all, our immune system weakens with age. So 65 years and older are going to have a weakened immune system that put them at higher risk for COVID-19 complications. Number two, they're going to be higher risk for having comorbid chronic medical conditions such as basically high blood pressure, cardiovascular disease, asthma, COPD, emphysema, diabetes, etc., that put them again at higher risk for COVID-19 complication. And the third, just looking at data from October of 2024 to September of 2025, we have seen 44,000 deaths due to COVID-19 in the US, and 2/3 of them are people over age 65. This is why we need to continue protecting and vaccinating our patients.
Now, what steps should families think about taking before these holiday gatherings?
Sure. So my top holiday tips include one, vaccinating everyone 6 months and over for the latest COVID-19 vaccine. Number two is good ventilation within your holiday gathering. So putting up those HEPA air filters so that way we have good ventilation, less propagation of the virus. Three, if someone has symptoms, any cold symptoms, that they wear a mask, especially around the most vulnerable, those newborn babies or people greater than 65 years of age. Number four, if you do have any cold symptoms, that you do a COVID-19 test. So that way we make sure you don't bring this virus home to your family. And number five, universal precautions. Frequent hand washing still works very well at not propagating these viruses.
It's interesting. A lot has been said about getting or not getting vaccinated. Where should our audience be looking for guidance on vaccinations for the COVID-19 virus?
So what I recommend to patients, number one, is talking to your trusty vaccine messenger, which is your primary care doctor, so that you basically promote a dialogue where you bring your questions, etc. Number two is trusted websites such as the Champions for Vaccine Education, Equity, and Progress, cveep.org. People can also go to the latest CDC website or the local Department of Public Health website as well too, where all this beautiful information is detailed on COVID-19 vaccinations.
Now, what should we know about long COVID's impact on older adults?
So we know that long COVID is correlated with recurrent or frequent COVID-19 infections. So the more people get COVID-19 infections, the higher the risk of long COVID and long COVID complications. We know that basically when it comes to this virus, it's a very inflammatory virus. So as it enters different organs, it can cause long COVID complications, such as when it enters the heart, it can basically put people at risk for arrhythmias, heart attacks. When it goes into the lungs, it can promote new onset asthma, COPD, or emphysema. When it goes to the brain, it can cause new onset development of stroke. Or now we know from the clinical studies, there's a correlation between long COVID and development of Alzheimer's. These are all reasons to get vaccinated and protected to prevent long COVID symptoms.
Now, where can we go to get more information for local guidance and access to COVID-19 vaccines?
So people can talk to their local doctor or local pharmacist to get the latest COVID-19 vaccine. They're well covered through private insurance, Medicare, and Medicaid. They can also go to their local Department of Public Health website, where usually you can tell if there's any free clinics available for free COVID-19 vaccines for people without insurance as well too. So that way we have everyone covered.
I've been speaking with respiratory specialist, Dr. Juanita Mora. I have one more question for you before we get out of here. For Thanksgiving dessert, what's your favorite? We've already talked about pecan pie, pumpkin tarts, and peach cobbler. What's your favorite dessert?
Pumpkin cheesecake.
I like that a lot. That sounds good too.
It's so yummy. My favorite treat on Thanksgiving.
There you go. Dr. Juanita Mora, thank you so much for joining us on Morning Blend. Thank you.
You're welcome. Have a beautiful day.
You
Happy
too.
holidays.
Happy holidays.